Time for everybody to come in. So I'll just give it a little bit of time and then we'll begin. Okay. Welcome everybody. Thank you for joining today and joining the stakeholder group of Persons with Disabilities event today, which is on the experiences of persons with disabilities and COVID-19 in Bangladesh, Bolivia, and Nigeria. My name is Elizabeth Lockwood, and I'm from CBM Global, and I'm your moderator today. I'll begin with a few housekeeping items. This event is being recorded and will be shared later. We are very fortunate to have international sign interpretation, Spanish interpretation, and live captioning. The international sign interpreter is spotlighted, and you can pin and resize the image for yourself. Live captions are available by clicking on the closed captioning box, the CC box on the bottom of your screen. And to access Spanish interpretation, please click on the globe icon that says interpretation and click on Spanish. Please, when you speak, the moderator, of course, the panelists and anybody speaking, please speak at a medium tone pace for the interpreters. That would be greatly appreciated. I would also ask that everybody keep their cameras off except for the presenters and the moderator, and also mute yourself when you aren't speaking. We aren't using any PowerPoint presentations or any visual materials. And throughout the event, please use the chat box to post questions that we'll get to later in the event. If we don't get to your questions, we will email you and we'll post an email before the end of the event. We will also post links to the reports and other information in the chat box, so please follow that along. So briefly, as an introduction, last year, almost 1 year ago, we presented the first phase of the research on the experiences of persons with disabilities around the world. It's qualitative research. We really wanted to see what barriers existed for persons with disabilities and what new barriers were emerging. What we found was overall, in many, many cases, there was lack of access to information on COVID-19 in all formats for all persons with disabilities, barriers in receiving social protection and employment, and lack of disability inclusion in response and recovery efforts, as well as the changing role of organizations of persons with disabilities, lack of access to healthcare facilities, and lack of disability data in the COVID context. In the research we'll be talking about in just a moment, there are some new barriers that we found. We looked at 3 countries, Bangladesh, Bolivia, and Nigeria in more depth. And we looked at persons with disabilities who are more underrepresented. And we found there are additional barriers in the virtual work and educational setting, an increase of the digital divide, and barriers in the changing role in extended family structure and living situations. And I will let our researchers now speak more on this interesting work that they've done. Very pleased to have all of our researchers present their own findings to all of you. And we will start with Bangladesh, and then Bolivia, and then Nigeria. So I have the honor first to introduce our Bangladesh researchers, but only one will speak right now, but I'll introduce both. So our researchers are Sama Mahbub, who is the founder of the Bangladesh Society for Change and Advocacy Nexus, BSCAN. It's a woman-led OPD. She started to work with mainstream NGOs and OPDs to advocate on accessibility issues and as a woman and wheelchair user. And the other researcher on this is Muhammad Iftikhar Mahmood, who is the coordinator of BScan and a member of many OPDs in Bangladesh. And he will come in later in the Q&A session. So Salma, please go ahead. The floor is yours.
Hello, everyone. Can you hear me?
Yes, we can hear you.
Thank you. It was a pleasure to do this study and also to present the findings in front of you. This was a qualitative research study that was carried out by the stakeholder group of persons with disabilities from March to April 2021. Though in Bangladesh, the COVID-19 started in March 2020, and the research is on that period. We have tried to enhance the additional and new experiences of persons with disabilities in the COVID-19 situation they have encountered in Bangladesh. It was carried out through semi-structured in-depth interviews with individual persons with disabilities in open-ended queries and also document analysis. The study was carried out among 24 persons with disabilities with different types of disability, and also we have considered the gender, age, and geographical representation of Bangladesh. Like we have included persons with disabilities from 8 divisions of our countries.
Salma? Salma, we can't hear you. Can you try to speak? I know Salma's had some internet connection issues. Okay, we just lost her. Salma?
Hello, can you hear me?
Yes, we can hear you. Wonderful, you're back. Okay. Go ahead, please.
The findings, the significant findings that we found that the health facilities were not prepared, still not prepared for persons with disabilities, especially for persons with severe disability. Even the government did not set any indicator to detect COVID-19 affected persons with disabilities and priority for vaccination. Though they have created an application app that registering the citizen of the country for vaccination, but there was no indicator for persons with disabilities. For that reason, a huge number of persons with disabilities are still lacking the vaccination facilities. The unemployment situation of persons with disabilities did not get any special consideration.
Salma, we lost you again.
Hello.
Oh, you're here. Yes, we can hear you. Hello?
Yeah.
Okay, go ahead, please.
The lack of information and accessibility regarding COVID-19 in health, employment, social protection, education, and livelihood have hindered the recognition of the 2030 agenda, you know, that we are considering the no one left behind. And persons with disabilities are exposed to a vulnerable consideration. Social protection mechanism during emergency crisis management has exposed their discriminatory provisions to exclude persons with disability as their regular candidate of disability allowances, which is very normal and provided quarterly or half yearly. It was very surprising for us. Even in this pandemic situation, it was not delivered on an emergency basis, but it was considered as a excuse to exclude them from the emergency support that government was providing. This study has had a financial and human resource shortage, as well as because of pandemic, we had to take the interviews over the phone and using other digital platforms, because we are taking the interviews in a distance, keeping the distance, because we are not able to meet those people in person. Moreover, both of us, me and Iftikhar, were affected by COVID-19, and it was also fortunate that we recovered and finished the research during due time. The study result can be, we are happy that the study result can be used for the local DPOs and bilateral donors, UN agencies and INGOs to promote the rights of persons with disabilities and protect them from the discrimination. It will bring new findings, which will help to advocate new issues, as well as realizing the 2030 agenda that we talk about. It will enhance the evidence-based advocacy with the government and share information with fellow DPOs leaders in other countries as well. The project's main aim was to collect the national level data and stories to help frame policy and program response post-COVID. The findings from the country level work in Bangladesh are framed within future policy and program under the 2030 agenda, particularly in the areas of health, social protection, employment, livelihood, and accessibility. Before the pandemic, the collaboration between the civil society organization, disabled people organization, and the government was progressing. You know that Bangladesh is the one of the first line country that signed the UN CRPD, and the realization of the SDG that reflected through Sustainable Development Goal was increasing. The disability rights agenda has, but the disability rights agenda has lagged in terms of access to healthcare, employment, and economic recovery. In most cases, the government high officials are not willing to meet face-to-face, and also let them to respond over the phone in advocacy issues for disability rights. Hence, a gap between DPO leaders and policymakers is being created. The government has left out persons with disabilities from food and or care support because of their enrollment in regular social protection programs. As a result, they have deprived of emergency support, and that indicates the presence of discrimination between social protection mechanism and emergency support. Employment and livelihood have been hampered due to the COVID-19 impact. A large number of general people have lost their job, which volatile the competitive job market. So it will be difficult for persons with disabilities, especially persons with severe disabilities, to get opportunities in new job entry, especially in private sector. Education institutions are closed over a year now. Moreover, the digital divide has been seen in education in case of persons with disabilities. Unavailability of smartphones, computers, the financial capacity to buy mobile data, to use the internet, and as well as low network coverage or mobile phone operators, and the lack of broadband connection or low bandwidth in rural and remote areas are escalating the digital division. A lack of new job circular prolonged educational life and discontinuation of entrepreneurs have led the persons with disabilities into depression and anxiety. In the long run, it will hamper the overall education and job competency. In most cases, the respondents have felt at a risk to get proper treatment if they contracted COVID-19. Moreover, they are concerned about their family members getting vaccines because of their dependency on them in their daily life. The reflection of data regarding the status of persons with disabilities was not found anywhere. The government is regularly publishing the data on the contracted persons with mortality in COVID-19, but there is no such information that is available on persons with disabilities. How many persons with disabilities have already vaccinated are not also published yet. Socioeconomic impact on persons with disabilities has not been found in government measured CSO impact studies on COVID-19, but some DPO, CSO, and INGO initiative have done some small-scale study which reflects the vulnerability of persons with disabilities during the COVID-19 pandemic. Hence, we are at the risk of achieving the target of no one left behind and the data revolution in 2030 agenda alongside CRPD commitment to inclusive development and emergency response. We actually urge the International Development Agency and UN bodies to give more pressure, not only them, we, the DPOs that are working for persons with disabilities, we need to keep creating more pressure on the government to take the measure against the pandemic for persons with disabilities. These are the main findings, some of the findings that we have tried to present in front of you.
Thank you so much, Salma and Iftikhar as well for your excellent work in this research. And we also have a version of the report in Bangla that will be forthcoming. So thank you so much. I will now move over to our next panelist, Ramiro Noches Mcna, who was our researcher for Bolivia. He is a software developer and has worked for nearly 20 years for different UN agencies and recently for the government ministries in Guatemala. He is a person with a disability and works with several organizations and groups to promote disability research. Thank you, Ramiro, and please go ahead.
Thank you. Great to be here. I will share our findings with the research we perform in Bolivia, okay? I will provide you first a research overview. This study is a qualitative exploratory research. It was performed in the period of March and April 2021 to persons with disability in Bolivia, both urban and rural areas, with no sex, age, income, or disability category preference. To determine the sample, organizations of persons with disability in Bolivia were contacted ahead to obtain possible candidates for interview. Of 31 persons contacted, 9 responded, a semi-structured questionnaire. The methodology applied started with video conferences when possible, but also phone calls and web form were utilized to collect the data. Also, information was researched and interviews were performed to government offices, programs, and organizations to determine responses and actions from other actors, either governmental or non-governmental. The main findings we got are the following, okay? We combined technology with social science methods to learn about the hardship reality encountered by persons with disability during the COVID-19 pandemic. After defining the sample and designing the collection instruments, we had a couple of interviews with persons with intellectual disability. Our initial strategy to collect data was to perform video conference that later we could use to extract most of the recorded information through a tool called qualitative data analysis. Some respondents did not feel comfortable being recorded, so we had to adapt the method and perform the interview. By combining several technologies, we were able to consolidate the different perspectives in a single database with all the information collected with different realities and points of view, and therefore could learn what the respondents had gone through. The second finding was that persons with disability want and need to be heard from their very own and diverse perspective and experience. During this study, we talked to 15 different interviewees. They all felt with the impression that they had been they wanted to share very much what they went through, the lockdown period and the hardship they went. They felt alone. That's my perception. They felt disappointed, stressed, and with a lot of uncertainty of what to expect. They wanted to share their stories. Many respondents encouraged me to share their thoughts with the international community because they felt disconnected from the larger global disability movement. The third major finding was the government response, okay? For most of the respondents, it was nil, with lacks of coordination and directly impacting the lives of the person with disabilities. Many respondents expressed frustration with the lack of response from the executive branch of the government. Many persons with disabilities went on strike to demand compliance with a disability bonus. The research indicates that there were too few protocols. Countrywide social programs or interventions and little action to protect and assist persons with disabilities during the peak of the COVID-19. In many cases, persons with disability had to improvise to get access to services during the lockdown measures. And also social and assistance networks stepped in and assisted many persons with disabilities. Also, there is a lack of disability data. This is very important in official sources, and thus a gap of the situation of persons with disability in Bolivia. A monitoring system to seek the CRPD compliance is needed, as COVID-19 demonstrated that persons with disabilities were simply left behind. The recommendations that came out of this study are the following. I will read you the three more important. It is important to develop a vaccination strategy for persons with disability that includes protocols of accessibility, communication formats, and adequate timing. The vaccination centers must be physically accessible, have information and adequate formats, and consider timing intervals so that persons with disability do not stay too long in the line waiting to be vaccinated, neither exposed to get infected of COVID-19. Medical staff should be sensibilized and trained on how to attend persons with disability. For rural or difficult areas, mobile units should be considered to reach persons with disability who cannot attend vaccination centers. The second recommendation is an adequate vaccination campaign should be developed and socialized on the benefits of being vaccinated, okay? The benefits of the vaccine and the convenience of being it. The campaign should include language sign, but also consider, in Bolivia, different languages and cultures so that it can be more easily accepted by the different communities and cultures. And the last one is It's important to stress the necessity of data collection, registration, and sharing of the information, not only to learn the actual number of persons with disability in Bolivia, but also their spatial distribution and how many got vaccinated or not, but also to prepare for future emergency events. As the world leaders have already discussed, it's not a matter of will it happen, but of when will it happen. So governments should be prepared for the next emergency. In any case, COVID-19 is not over, and the constant virus mutations are impacting even developed countries. Therefore, it is important to know precisely the location and condition of every person with disability so that he or she can be reached and attended more rapidly and efficiently in case of emergency. Thank you very much.
Thank you so much, Ramiro. It's a real pleasure to work with you. And you really touch on an interesting point about how some of your respondents were resistant about the vaccine because of lack of accessible information. And that's a really interesting piece to look at. So I really appreciate everything you've done. Now we have our final panelist. He will speak about the findings from Nigeria. Our panelist is Godwin Erokaba, who is a deaf leader from Nigeria. He is the Deputy Director for External Relations and Partnerships at University of Calabar in Nigeria. Please go ahead, Godwin. Godwin, you're on silent. You're on mute. You have to unmute yourself, please. We can't hear your interpreter.
Are you hearing me, please?
Yes, perfect.
Good afternoon. Are you still hearing me, please?
Yes.
Are you still hearing me?
We can hear you, yes.
All right. Good afternoon. By way of introduction, this research investigated the experiences of persons with disabilities in Nigeria during the COVID-19 pandemic. The study was conducted from February 1st to April 30, 2021, and carried out in 15 of Nigeria's 36 states. A total of 58 respondents with disabilities were surveyed. Methodology. The research was a qualitative study which investigated the experiences of persons with disability throughout Nigeria during the COVID-19 pandemic. Researchers gathered information from the respondents using in-depth, semi-structured one-on-one interviews, focus group discussions, observations, and surveys. A population-based cross-sectional survey of persons with disability was used to select 58 respondents. They represented 6 clusters of persons with disabilities. The snowball sampling method was used to locate the respondents. Referrals were also made by organizations of persons with disabilities, disability leaders, key informants, and service providers. The interviews were structured around key issues in the areas of health, social protection, employment, livelihood, and accessibility. The average age of the respondent was 37 years. Respondents were evenly selected across genders. Key findings. Key findings from the research indicate that the COVID-19 lockdown in Nigeria created exponential barriers and hardships on many persons with disabilities. Generally, many persons with disabilities in Nigeria face barriers accessing healthcare, and during the COVID-19 lockdown, barriers to access healthcare services increased. Hospitals were closed down, and only 1 or 2 health centers were opened in each state for the treatment of COVID-19 cases. The respondents shared that should any of them contract the COVID-19 virus, they believe they would not be given the same priority nor adequate treatment as persons without disabilities. Moreover, government orders imposing restrictions on movement and the reinforcement of social distancing created solitary effects on many persons with disabilities. The stay-at-home order exacerbated the social, economic, and emotional exclusion of persons with disabilities. This created a range of effects such as depression, family confrontations, anxiety, and withdrawal. Crime also increased, and persons with disabilities were affected. For example, one respondent with a physical disability was attacked, beaten, and robbed while on his way to visit a relative. He became hypervigilant, apprehensive, and anxious. The study also found that the exclusion of persons with disability from government rations, palliatives, and welfare packages affected the well-being of some respondents. For example, the fear of the unknown was cited by one respondent whose resources had depleted and did not know what would happen next. Other respondents reported that they struggled with feelings of despondency and hopelessness arising from the abandonment, neglect, and exclusion of persons with disabilities in the distribution of relief measures. Recommendations. Based upon these findings, it was recommended that a sensitization campaign to familiarize governments and their agencies about disability inclusion protocols during emergency should be considered. Information about COVID-19 should be made accessible in all formats for persons with disabilities. Many persons with disabilities cannot afford the luxury of technology, and many lack knowledge about how to operate technological devices to access information. Consequently, referring them to websites to get information on COVID-19 are not feasible. Other approaches should be explored, such as animated screensavers and pictures, TV commercials, and outdoor digital electric billboards projections on COVID-19 safeguards. Inclusive education, being the catalyst for the inclusion of persons with disability and social integration, should be used as a strategic tool to promote public awareness about persons with disabilities. Strengthening inclusive education systems in middle and low-income nations could help promote their ideals of including persons with disabilities in all aspects of government plans, including virtual learning during periods of lockdown. Furthermore, there is need to have accurate data on persons with disabilities at the federal, state, and local governments to facilitate planning and rapid response actions to ensure the inclusion of persons with disabilities during crisis and emergency situations. Governments at all levels should have updated statistics on persons with disabilities in their locations and localities. Lastly, government's COVID-19 websites should provide contact information of local contact persons for every state in order to access information, receive aid, and get assistances across to persons with disabilities in an emergency situation. Thank you.
Thank you so much, Godwin. It was wonderful, and I really appreciate all your hard work on this research as well in Nigeria. So now we have time for questions and discussion. Please use the chat box or raise your hand if you'd like to speak, and we can have a discussion. I have one question so far, but it'd be great to have some more. Or if somebody would like to speak, I don't see any hands. Okay, I'll start with our first question. The question is for all the panelists. Can each of the researchers tell us how they reached those most left behind? So again, can each of the researchers tell us how they reached those most left behind? I will start with Salma and Iftikhar. And maybe both of you could speak to this, or one of you. And I will start with you. Salma or Iftikhar, please go ahead, or both.
Go ahead, Elizabeth. It's me, Iftikhar.
Perfect. Iftikhar, please go ahead.
Yes, we have taken interview of a person with intellectual disability and his family member. And as well as we have also taken interview of a person with hearing disability.
I'm sorry, Iftikhar, can you speak up a little bit? It's hard to hear you.
Hello?
Yes, that's better.
Okay. We have taken interview with women with intellectual disability and his family member, as well as we have taken interview of person with visual disability, hearing disability, with the help of interpreter. These two things we have get sort out. But we have a connection with two person with psychosocial disability, those who are not available at that time because of their psychosocial condition. Their family are not allow us to take an interview at the condition. These three things, and as well as we are trying to reach many part of the Bangladesh, both urban and rural, as well as the poor people, and as well as 8 divisions of Bangladesh. As much as possible, we can reach. Anything more? If any question.
Salma, do you want to? Great.
Yeah, just to add, as we know that the person with hearing disabilities are most left behind. So we try to communicate with them with the messenger and also Skype and sign language interpretation and Google Meet. These are the platforms we have used to take their opinion on the pandemic situation. And also we have tried to consider the economic condition of the persons that we interviewed, also the different professions was also considered. Thank you.
Thank you so much, Godwin. I see your hand is up. So Godwin, please go ahead and answer next.
Thank you. I met key informants. In all the locations I visited, I met the key informants that helped me to meet with this disabled association. I also use service providers that helped me to give me key information on where to locate disabled people. So all of them were very helpful to me as they helped me to meet disabled people in their areas. I actually meet community leaders that help me to inform me about where disabled people can easily be located.
Thank you. Thank you, Godwin. Ramiro, please go ahead.
Well, we focus on two areas, okay? We try to reach the rural area first. And the second was that we try to work with population from intellectual disabilities, okay? It was very interesting to hear from their experiences because we had people with autism and other type of intellectual disabilities, and they were interviewed themselves. So we could get their impressions and their experience from their own lives, all right? One of the particular cases that I recall is from this young man who was living in the rural area alone. And he went through all this process and he shared with me what was all his experience. It was very tough, okay? Because besides the communication issues, the restriction of movement and everything, it was very complicated for him. But we also gather information from other cases, from intellectual disabilities. So I think that we really could get new findings, new opinions of persons who are commonly not contacted, okay? And I think that we got them. Perhaps there's much to be done yet, but we got an advance right now, okay? Thank you.
Thank you so much, Ramiro. Wonderful. We have three questions, three more questions for you. So I will ask them all. Okay, they are, I can group them in two. The first one, very, very good question. Did any of you notice an increased mortality rate of persons with disabilities versus the rest of the population in any of the countries that you researched? And then the next two questions are about partnerships. First, did you find that organizations of persons with disabilities were good networks for getting practical support during the pandemic? And second, were the research findings used by broader national civil society alliances to include persons with disabilities and advocacy in the COVID context? So those are it's a lot to answer. I will see who wants to go first. Is there somebody who specifically wants to answer one of those questions first?
Elizabeth, can I?
Yes, perfect. Go ahead, Iftikhar, thank you.
Okay. The first question, the mortality rate, the comparison between person with disabilities and non-person with disabilities, okay? Then in Bangladesh, we have get information by the Department of Health under Ministry of Health, the mortality rate and the affected rate among our men and women. But we didn't get any information till now about the mortality rate or the affected rate among persons with disabilities. So it is a data crisis, you know, what is the common phenomena in our developing countries. This is, we are looking for to get out from it from the health department. But they have not taken any indicator about persons with disabilities. That's why they didn't get any information on it. Okay. Can I clear on it?
Great. Salma, anything to add to that?
Not really. Data is the thing that we are looking for, but I want to answer on the other question about the networks, if that helped us. Of course, it helped us a lot as a researcher with disability and as a person with disability, and also working in a DPO and also in a DPO network. It helped us a lot to find those peoples with disabilities and who are in very much vulnerable condition, and to understand their problems or their issues better than other researchers. It actually helped. And also about if we used the research in broader national coalition or national level, we didn't, because it is not published yet. It is not circulated. After it's circulated, we will surely work on the national level, on also with the government, that this is the situation and we want to change it, or we want to work on it with the government and the non-government. And also we want the DPOs to use this as the evidence for the pandemic situation. Thank you.
Can I answer the second question?
Yes, please, go ahead.
Okay, this is the second question was what the role of OPD during the COVID-19 situation, isn't it?
Yes, correct, yes.
Okay. It was an interesting findings that none of the interviewee have get any cash support from the government or food support. But interestingly, many of the persons with disabilities have get the cash support from the DPOs and OPDs, and as well as they have get food support from the OPDs. Okay, this is very interesting thing that what we have found that the OPDs are the most nearest friend for persons with disabilities, even stronger than the government. You know. Okay.
Mm-hmm.
This is my second question answer. And the third, I think the third question was what the national level CSOs have connected or involved the OPDs to advocate the issues of COVID-19, isn't it?
Yes.
Okay.
Yep.
That is the fact that national level DBs, you know, the national level platforms are different 2 or 3 platforms in Bangladesh, those who are involved with the government to advocate COVID-19 situation. But you know, during the COVID-19, the government are hugely in focused on the economic remuneration. Because of those, and the health problem is the persons with general people. So it hampered the progress what was before the COVID-19 situation about the persons with disabilities, not only from the CSO side at national level, but also from the government side. But during this 1.5 year, the communication and strong connection between the DP, OPDs and the government, and as well as the CSOs have been reluctant because their interesting issues are changed, and the issues of persons with disabilities are lagging behind between this. Thank you.
Thank you. Somebody wrote in the chat box, in the meantime, in UK, our Office of National Statistics has found 59% of fatalities were disabled people based on questions asked about disability in the 2011 census, so likely to underrepresent by 9% further. Wow. Godwin, I know your hand was up, so if you'd like to answer next, please go ahead. Godwin, would you like to answer?
Are you hearing, please? Godwin
Yes.
wants to comment.
I hear you. Yep.
Our study was not focused on ascertaining the mortality rates of persons with disabilities, but rather their experiences during the lockdown. Also, we had guiding questions we used for the interviews. Those questions did not touch on the issue of mortality.
Although the question of mortality is important.
Although the questions of mortality were very important. Maybe future research will capture all that.
Thank you. Would you like to answer more? Okay, I'll go ahead to Ramiro. Thank you for your patience.
Yes, I think that this is one of our greatest weakness, okay? We are not collecting the variable for disability. So we don't know what is the mortality rate, and many other issues we don't know it because these variables are not being captured. So I think this is a very important work to be done. But I also think that at the political level, we also need to do more, okay? Because we are not generating information because we're not taking in consideration too many issues, right? But this happens at the political level. I think that we need to do more on that issue. I would like to take advantage of this moment just to answer to Jose Viera's 2 questions. Our experience, if I may, if it's okay?
Please, nice segue.
Okay, the experience to perform research as a person with disability, I think is very nice, very interesting, because we know what is going on. We live that, okay? We live that reality. So we have a lot also to share within the experience. We can compare with our own living, right? So I think it was great to know that. Also, my perception is that when we identify ourselves as a person with disability doing the research, the other person with disability felt more comfortable to share their experience as well, because we could understand their reality, okay? And with regards to the second question of Jose, yes, we have recommendations from OPDs, okay? And this is what my perception is, what I see, is that OPDs and government offices are far away, okay? They need to be closer. They need to work more together, okay? Because we, as persons with disability, know what we need, okay? The troubles, the problems we're facing. So we need to have channels of communication that will allow us to be more effective, and the government needs to respond to that as well. Thank you.
Thank you, Ramiro, and thank you for that wonderful segue. So there are two questions in the chat box. So for the other researchers, very good questions. They are, how was your experience as researchers with disabilities? What lessons did you learn? Recommendations for others? And the second question, what recommendations did you collect from OPDs to their governments, specifically in the COVID-19 emergency response? So maybe Godwin, do you want to go ahead, or Sama, Iftikhar? It's up to you to answer either or both of these great questions.
Yes, Godwin is ready. Please, which of the questions are we attempting now, please?
Either one or both. It's up to you.
Okay, is it the first question that talks about the experience as a researcher with disabilities?
Correct, yes.
I have an interesting experience as a person with disability, since I am a disabled person myself. This research has exposed me to so many things. First, the research affords me opportunity to meet with other organizations of persons with disability, interact with them, know their problems and their situations, and also the challenges that they are facing. Also, as a disabled person myself, it helped me to meet other disabled people, and it makes them to be free to share their experiences with me. They were not shy, they were not afraid, and they trusted me with their information that helped me to carry out the research. Their experiences was wonderful in the research.
Wonderful. Did you want to answer the second question as well, on recommendations collected from OPDs to governments, especially on emergency response?
Yes, I can answer.
Perfect.
In Nigeria, OPDs were very, very ineffective because they could not stand and fight for people with disabilities. People with disabilities in Nigeria were abandoned and neglected. So they were forgotten by the government entirely. So they needed a voice, somebody that could speak for them. Meanwhile, OPD in Nigeria cannot give them that voice. And as a result, so many of them suffered, they struggled during that COVID-19 lockdown. I met with some of them in Nigeria and asked them what was their situation all about. And they explained that the government did not invite them, did not communicate with them, they were neglected. So the worst problem in Nigeria is that OPDs don't have any office in Nigeria where they function or where people with disabilities could channel their complaint. Some sit under the trees, some sit under the trees to carry out their different activities. So the challenges are many facing OPDs in Nigeria.
Thank you so much, Godwin. And just to end with Iftikhar and Salma, please, you can have the last word to answer these questions. Either, both, please go ahead.
Okay. Actually, it was a different experience for us as a researcher with disabilities. It was great to be a researcher for the persons with disability as a person with disability. And we have learned how to do distant interviews and take those information and analyze it and make a report. We regularly write the event reports. We have also have experience of accessibility audit report writing, but this particular report write-up was helped us to enhance our tacit knowledge to explicit knowledge, actually. And about the recommendation, I would like to say that OPDs and persons with disabilities actually wanted to be prioritized in the vaccination, and also in this economic dire situation, the OPDs are in a vulnerable condition to run their organization, so that so they want the focus of government on these organizations, so that these are the people that advocating for the persons with disabilities. So their survival is more important. So they want the government to emphasize on these issues as well. And also in the health sector, persons with disabilities are not getting the priority, and the health facilities, especially the severe persons with disabilities, that is what they wanted, the attraction of the government. And also in the vaccine program, they wanted the caregiver or the close persons with severe disability, they should get the priority of getting the vaccine, so that the severe persons with disabilities are safe from the COVID-19 attack. Thank you.
Thank you so much. I'll just read one comment here. A person wrote, I'm aware that in Nigeria during the lockdown and distribution of palliatives, several of the OPDs came together to push for inclusion. So persons with disabilities in the process, and successes were recorded. I work with several OPDs with offices and contacts, so I'd like to submit that OPDs in Nigeria are effective and active in advocacy. However, I agree that there's room for improvement. Thank you very much for that comment. And we have 1 minute left, so I will just close. I am so thank you for all of you who attended, our 4 lovely panelists, the International Sign, Nigerian Sign Language and Spanish interpreters, and the captioners, and all of you. We will share the recording and presentation soon. Please email me for any follow-up questions. My email's in the chat box. And also thank you so much to the logistics support from Ida and everybody, and for the stakeholder group of persons with disabilities, Jose Vieira and Mohammed Lutfi and Bethany Brown and Aaron. Thank you all very much. And thank you to everyone. Have a great day, and we'll see you soon. Thank you. Bye-bye.
Thank you.